Good morning, everyone. My name's Carla Macias, host of San Antonio's own medical show, Best Docs Network, featuring one of the top medical facilities in Texas, and that is Forest Park Medical Center, where it's your destination to better health. We've got a great show for you today. We'll be featuring some of today's current health topics, as well as some of the latest procedures offered by some of the best physicians here in San Antonio. Now let's get today's show started by introducing plastic surgeon Dr. Peter Fisher.
My issue that I sought out surgery for is that I have a 200-pound weight loss, and that leaves your body very disfigured. If you need a mommy makeover or a tummy tuck or a breast lift, you could probably go locally and find a competent surgeon. I looked in Atlanta for surgeons, and there was none I was convinced in Atlanta that were true massive weight loss specialists. I found Dr. Fisher, and I did a consult with him. I had looked on his website, saw that he did have a specialty with the massive weight loss patients. But what really sealed the deal is when I talked to him. And when you talk to him, he gives you so much time and attention. He answered all my questions very thoroughly and thoughtfully, and with me in mind.
Melanie came in specifically because she felt like I could do a little bit more with her thighs and calves. She had had a gastric sleeve, had lost close to 200 pounds. At the initial consultation, I felt like we could get all the procedures that she wanted done in 2 operative sequences. And these included a lower body lift, which incorporates 5 different aspects, which is a tummy tuck, a Mons lift, a very strong lateral thigh lift, a buttock lift, and also the ability to do a buttock augmentation and hip augmentation.
Having the massive weight loss plastics afterwards is truly a way to complete your weight loss journey and feel good about yourself, to actually have a body you can feel good about. I wore my first bikini 6 weeks ago on a beach. I had never worn a bikini in my life, and I was so happy. And it's just a feeling you cannot imagine. To be able to do that for your first time in your life, it's freedom.
The ideal candidate for this procedure is someone who's really lost a lot of weight and is really unhappy with their body. They have excess skin in areas that cause them problems. It's really unsightly, and they're just not happy with the way they look.
All that contributed to the process was the good sense to choose a doctor like Dr. Fisher.
Barbecue and Blessing. It's our community event, and we're so excited to have reached this milestone in San Antonio. We have Chamber of Commerce weather today. It is absolutely gorgeous. We have the Chamber here to do our ribbon cutting with us. We also have the Dallas Cowboy cheerleaders here, Rowdy's here as well. Just a lot of activity and press as we kick off this facility in San Antonio.
The whole premise behind Forest Park is we're going to do surgery differently than everyone else. We're going to treat patients differently. We're going to have outcomes that reflect a higher quality of care. When we look at robotics, what Da Vinci provides is the ability to, with a minimally invasive fashion, to go in and operate on a patient. So instead of making a large incision in a patient, we're able to do it through small incisions that are placed throughout the patient's abdomen. So if I have a smaller incision, I can have maybe less post-operative pain or less blood loss throughout the surgery. It's much more accommodating to know that at the end of the day, I didn't leave with a large scar. I didn't leave with the associated pain and post-operative complications of having that.
We are always so excited to be a part of these openings, and this is probably one of the best ribbon cuttings that we've ever been to with the Chamber. This is awesome. The facility is gorgeous, and everybody should come out and have a chance to take a look at this, because they should be very, very proud of what's in their community.
We're really excited to be a part of this. This is our 5th development for Forest Park so far. It's really a special day for us to be able to invite everybody into our house, to show them all of the work that we've been putting in place over the last year and a half, to show them all of the finishes, all of the art, all of the furniture, to tour them through. They can really get excited about it now and see the reality of those renderings that they saw years ago. Now they're resurrected into what they can walk through and touch today.
We are so excited about opening day. We are ready to go. We've been positioning and preparing this facility for over 2.5 years. And with our over 100 physician partners and over 450 credentialing physicians here, the sky's the limit. We are so excited to raise the level of care in San Antonio.
The PRMA Group specializes in breast reconstruction surgery as well as many other plastic surgery procedures. Dr. Gary Arishita is a plastic surgeon here in the San Antonio area. Now let's meet the doctor.
I was in the military for 25 years and did a lot of breast reconstruction in the military. I got into plastic surgery a little bit by chance. I was doing a plastic surgery rotation in medical school. We did a breast reconstruction on a woman. We went in to see her and she was just sobbing. What she said was that her husband hadn't seen her undressed ever since she had her mastectomy. She was so happy that she could turn on the lights now. It sounds corny, but it was such a profound moment for me. I kind of decided then that that's what I wanted to do. When I retired from the military, I was able to join this wonderful practice and really specialize in breast reconstruction.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health.
All of our body has some fat, but when the liver has more than 6 to 10% of fat, this is what we call fatty liver, and this is too much. Fatty liver is usually discovered by accident because patients normally don't have any symptoms. So when the doctor detects elevated liver enzymes, he may do a workup to find out why the patient has elevated liver enzymes. Fatty liver is more common on patients who have insulin resistance, patients who are overweight, or patients who have diabetes. It is also more common in patients who drink alcohol. It can also have some hereditary factors. If your doctor detects elevated liver enzymes, he may want to run some tests to make sure that you don't have uncontrolled diabetes, high triglycerides, or other diseases like hepatitis C that may also cause elevated liver enzymes. He may also run some tests like an ultrasound of the liver, and he may do an MRI elastography to find out if your liver has the common fatty liver called NFALD, or if it has the more severe cause of elevated liver enzymes called NASH. In this case, what happens is the liver enzymes are going to be high, but patients tend to have severe inflammation of the liver that can progress to liver cirrhosis and eventually to liver cancer. So it is very important to differentiate between the two causes. So what things can you do if you have fatty liver? One of the things is to exercise, to lose weight, and by all means, avoid alcohol. If you have high triglycerides or high cholesterol, make sure that you control those and make sure to control your diabetes also. If the condition progresses, make sure that you see a liver specialist, as you may be a candidate for research or for a liver transplant.
Forest Park Medical Center is being hailed as a 5-star hotel of hospitals. With that being said, you can only expect the food to be just as exceptional. Up next, we're going to take a look at the dining experience of Forest Park Medical Center, San Antonio.
I'm the Director of Food and Nutrition Services here at Forest Park, San Antonio. My scope of responsibility is to provide food service to all the patients in the hospital, as well as the staff and the patient families that come to visit their loved ones here at the hospital. We like to operate here as a hospital that will be within a hotel setting. So everything that we do is predicated on offering good quality food, great variety, and top-notch service. I draw a lot on my background, having worked in hotels and restaurants and country clubs in my prior assignments, to bring that level of flair and service to this operation. The head chef is a lady from Thailand. Her name is Bibi Stillwell, and she does an amazingly good job here, bringing in a lot of Asian influence for a little bit of variety to what we do every day. We have a wonderfully diverse department, very representative of the community that we serve. Everybody, as they come in, are put through rigorous training to make sure that we follow all of our recipes and procedures, and we very actively encourage them to bring forward their own ideas, which we can then incorporate into our ever-changing variety of menu items. When you walk into our cafe, the first thing you notice are the floor-to-ceiling windows with the great hill country views. We have fresh flowers on the table, artwork on the walls. So we want to get away from the sterile and somewhat non-welcoming environment that is found in many hospital cafeterias. We have a fixed menu of items that we have all the time so that people can count on something being available, but we pride ourselves on an endless variety of fresh prepared dishes that we change on a daily basis. Everything here is prepared fresh to order every single day. We do not use prepackaged foods. We buy the best foods from the leading purveyors in town. One of the items that we're the most proud of is our Woodstone pizza oven, where we can prepare a variety of pizzas and flatbreads. The dining aspect of patient care is very important for a patient's speedy recovery. We have to be aware of potential limitations. Our patient menus are carefully calibrated by dietitians to ensure they meet the nutritional needs of a patient. As soon as we can, we progress onto the foods that they like, and it really helps physically and also psychologically with recovery. When people first come into our area, we want them to think that they are not in a hospital, that they are inside a very nice hotel that is focused on good quality food and great service.
Victor has a question for Dr. Martinez. Should I take an aspirin during a heart attack?
It's very important to take an aspirin if you feel like you may be having a heart attack or having symptoms of a heart attack. Aspirin is important because it tends to reduce the likelihood of any of the cells from sticking that can cause clots, which is a very big problem with heart attacks. A common misconception is that Tylenol, ibuprofen, and aspirin are interchangeable, but Tylenol and ibuprofen don't function the same way as aspirin. And if you suspect you may be having a heart attack, taking 4 baby aspirins or a full dose 325 milligram aspirin is important to take.
One of the things that attracted me to Forest Park was the level of commitment, not only with the leadership, but also the commitment from the physician partners. They want the highest level of quality for their patients. They also want an aesthetically pleasing environment for their patients as well. We are going to have great teams where everyone is actively involved in all the decisions that are made in the department. Not only the employees, but the surgeons and the anesthesiologists have also been very actively engaged in helping us make decisions on policy and how we're going to run the department, so it's very exciting. Our operating room is by far going to be the best in the city because of the equipment that we have, because of the caliber of staff and their expertise. The physicians that we have partnered with are all exceptional. The relationship that the OR staff have with the surgeons and the anesthesiologists is much closer than most would expect. They've become more of family to us. One of the things that excites me about this project is we get to start off with a brand new culture and set expectations for exceptional care and pride and commitment to the organization. Instead of going into a culture that's already been established, we all get to kind of take part in creating it ourselves. And it's very exciting for me as a leader, and I think that it's going to be very exciting for the staff also.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Smartphones and on-the-go technology are on the rise, causing Americans to use headphones more often. But did you know that wearing headphones for just an hour could increase the bacteria in your ear by 700 times? If you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. You can do this by clicking on San Antonio under the Our Doctors tab. One of those doctors you can find on our website is General Surgeon Dr. Kathy Grove. Now let's listen as Dr. Grove discusses the mastectomy procedure.
My diagnosis was in 2011. I found a lump. So I went to my gynecologist and he did an ultrasound and I have a lump the size of an M&M. 1 month later, it was the size of a lime. So I went with Dr. Grove. She gave me options. I decided to have the whole tumor removed. That's when we found out I have breast cancer. When I first found out, it was hard because I have 2 kids. I have 2 girls. They were very young.
Claudia, she came to us with a very advanced breast cancer. It required mastectomy. The type of cancer she had is one that tends to occur in both breasts. In her case, we performed mastectomy without immediate reconstruction for the purpose of getting her through her life-saving cancer treatment. I was really concerned for Claudia when she came to see us because she started with a cancer that was very aggressive and very large. Thankfully, she has done amazing. She's recovered very well, and she's coming up on her 5th year following the surgery. At 5 years, we start to think about the possibility of cure for her.
I feel great. I'm grateful with Dr. Grove, with all my doctors, but especially with her, because it's been so easy to live all this, knowing that Dr. Grove is there for me. I really appreciate the fact that she went out of her way to check if my cancer was genetic because of my girls. She wanted to make sure that if that was the case, she wanted to help them too, from an early age. Nobody did anything like that for me, ever. It was amazing. I'm really grateful with Dr. Grove.
We're excited to be here today. Forest Park is sponsoring the 2nd annual Zero Prostate Cancer Run. It's a great opportunity to bring awareness to this cause and to reduce prostate cancer. This disease affects our fathers, our brothers, our husbands, our sons.
This is the 2nd year we've had this run. Our first year was a very successful year, and it seems that this one has been equally as successful. We are privileged and honored to have so many people turn out for this event. The fact that 30,000 to 40,000 men are still dying from this disease is a concern, and so we are trying to just raise that awareness in the community.
support has been amazing, and to all the folks here in San Antonio that have come out.
And in particular, we've had great support from Forest Park. They've been a wonderful partner in this event. Just can't say enough good things about them. If you find prostate cancer early, you're not going to die from prostate cancer. There's a good chance you're going to do really, really well.
Urology is the branch of medicine that focuses on the urinary tract system and male reproductive organs. Now let's introduce San Antonio urologist Dr. Michael White.
I'm Michael White, and I'm a urologist with Urology San Antonio, and I specialize in robotic surgery. My main purpose with robotic surgery is to minimize patients' discomfort, yet still treat them like a family member and how I would have my family treated. I did my training at the Cleveland Clinic, so I bring a high level of robotic training to the area.
If you or anyone that you know are looking for a new family physician in the San Antonio area, then stay tuned because this next segment is for you. Up next, we have family physician Dr. Jesus Rodriguez. Dr. Rodriguez will be discussing a diagnosis of gallbladder removal.
The gallbladder is a small sac that sits under the liver, and its purpose is to store the bile that's being made by the liver. And we use bile to help digest the fats in our diet. Now, most people can develop gallstones over time. As these stones move within the gallbladder and out to the cystic duct and out to the common bile duct, they create pain. But typically what happens is that the gallstones can get lodged within the cystic duct, and that creates an obstruction. So then what happens is that the gallbladder wall can become inflamed and swollen, and then this leads to an infection.
I felt a lot of nausea and just a lot of chest pain. I didn't think it was my gallbladder at first. I was thinking it was maybe acid reflux or something, so I let it go on for a while. When Dr. Rodriguez saw me for the first time, it was my first day of work, and I let him know that I wasn't feeling too good. He saw me and he found out that it might be gallstones.
So I decided to do an examination on her, and on exam she had a swelling on the right upper quadrant of her abdomen. It was exquisitely tender, which made me think of a gallbladder disease. So we decided to do an ultrasound here in the clinic, and it did confirm my suspicion. She had an inflamed gallbladder wall, and she had a gallstone lodged within the cystic duct. I decided to go ahead and admit her to the hospital. I did start her on some IV fluids, some IV antibiotics, and consulted a surgeon. So that same day, the surgeon evaluated her and took her to the OR. She underwent a laparoscopic cholecystectomy, which is removal of the gallbladder, and she did well post-operatively. She was ready to go home within a couple of days.
Today I'm doing a whole lot better. I'm back to eating regular foods, back to my normal everyday routine. My experience with Dr. Rodriguez as a doctor and also as his employee, it's been great. He's a wonderful doctor. He takes the time to get to know his patients. He's very thorough. I'm just grateful that Dr. Rodriguez was able to catch it sooner before it got any worse.
Select Art I started about 28 years ago. It's a private gallery, and I specialize in providing art for public spaces and primarily doing hospitals and MOBs. And over the 28 years, I've probably installed everything all comes together and it's like, wow, this is great, you know, and people are excited and they're lit up and we get compliments, you know, the day we install it from the employees that are around, and, you know, it's a win for everybody. So, yeah, we all just keep moving forward.
Aaron has a question for Dr. Sayeed. What are some of the causes that would lead someone to have a revision of a total joint replacement?
Some of the more common causes of needing a revision total joint replacement are implant wear, implant loosening, dislocation, as well as a small chance of an infection. As with any surgery, there's always a chance of an infection, and this also goes for total joint replacement surgery.
Didn't find the right doctor on today's episode? Head to our website, bestdocsnetwork.com. There you can browse through our doctor specialty gallery. Best Docs Network, helping people find the right doctor and bringing medical education to you. So long, San Antonio, and we will see you next week.